I guess I sort of started falling into drug using or drinking at a young age, and I guess before then, it's I really sort of found that whole of trying to fit into life or trying to fit into things was a little bit difficult for me, and so yeah, I sort of reached out to I guess substances or anything that anybody else was using at that point to bridge sort of bridges, but throughout my life, it has been a struggle for identity, and yeah, it's been awful actually. But it's also been a bit of a self-discovery sort of journey in itself. I guess by the age of my late 20s, I found it really difficult. I couldn't really kick down housing. I lost skills to be able to think of how to, I guess, work the system or what to do. And I ended up homeless. And I remember the first time it happened, it was terrifying. It really was. You're walking around completely in a daze. You don't know what to do, or you don't know what to be, or what to say, or who to approach, or who to talk to. And I guess that's the crippling part about it when you sort of go into those states because you don't sleep, you don't eat, and you're just riddled with fear, and you don't know what to do. Yeah, it's I've been on and off the streets, boarding houses, homelessness. I haven't really had a rental since I was 26, so it's always just been a large chunk of it sleeping rough and homeless. And yeah, it got to a point, I guess, only a couple of years ago, or just after coronavirus. I was in the house during coronavirus, so I couldn't really. I was still walking around as a bit of a zombie. And yeah, I was approached by Housing for Health, and yeah, I didn't realise, but a doctor put a what's it called, nominated me for Housing for Health. Yeah, yeah, I wasn't aware of it, and suddenly I was getting approached by people. I was a bit suspicious of what was going on. Yeah, I got housed. I got put into a supported sort of area where there was staff that were looking over me and were understanding. I guess that where I came from, I was a bit I was a bit wild, or not wild, but just a bit unlearned, unskilled in living. I just sort of I've always dreamed what it'd be like to be able to have my own little private space. Somewhere I was out of public eye. How I'd feel and what I'd do and what my place would be like. And until I experienced being in that situation, yeah, it was a mystery. And I saw I wasn't living well. I didn't have the skills to actually look after myself or, to take care of myself or my environment. I went into rehabilitation, and yeah, that helped a lot. Main motivator of that was to learn how to live properly. I wanted. So now, yeah, I'm quite healthy, and I've been really putting good stuff into my ears, like a lot of podcasts that are, encouraging. They channeled it to me. I guess they helped me to, to discover it for myself, but also to lead me to it. It's really, I don't know how to explain it properly. It was just an amazing sort of setup that they had at Housing for Health. It was incredible. I guess when you're locked in that type of world of homelessness, you don't think it's reachable to the rest of the world. You're sort of stuck there, and having compassion shown back to you it was an amazing sort of experience. Didn't feel such a freak. Yeah, I started when I was 15 painting, so I sort of held down a job pretty well right up to 27, 28, and then wasn't able to, really hold a job down too long. But I still worked from, yeah, that age up into my 30s and 40s here and there, but it was always like, sleeping in building sites and, never really, I was always still sleeping rough when I was working. But yeah, to work now is just, yeah, it's incredible. To be working on my addictive side, my problems in that area, it's lovely to be able to know that I can go to work and not feel compelled to make a disaster of it. It's good. I've got a real heart for it because a lot of the properties I go into are occupied. So we're just painting a door frame here or a door here. But it's also meeting the tenants as well. See a lot of people that are sort of going through not similar things, but on the edge of, society a bit. Before I got this job, I was going to start studying at TAFE a little bit, and maybe see if we get into what's it called, social support work or social work, something along those lines. Yeah, I think it'd be rewarding, and also just to open my eyes a bit, get me out of myself.